All right, guys, part 3 of the infection sepsis issues. Um, and we're going to kick back off again, talking a little bit about a couple of the other airborne viruses. These, again, were all viruses that were going to kill us, kind of like COVID. It was going to kill us, it was going to destroy us, and guess what? We survived it. Imagine that. So we're going to talk about some of these other ones, but I bring the H5N1. I bring it up because the birds were going to fly over. They were going to infect all the humans, and the humans were going to die. And this was 5-6 years ago. I bought a bunch of Bitcoin because I thought that we were going to be dead the next year. And well, we're still here. Imagine that. Okay, but that's kind of where I go with my point earlier when in the other two videos when I said, hey, look, this isn't the first time we've dealt with these, earth-shattering pandemic. Godzilla was going to come out of the ocean and destroy us, and guys, it didn't happen. Okay, and I'm not saying that it won't happen, but I'm saying that again, very important to bring up that again, we have faced other diseases in the past. Again, influenza-type symptoms is what you're going to see with these guys. The avian flus, H5N1, H1N1, which is the swine flu, by the way. So, again, all of these things, again, they were going to destroy us and wipe us out. Now, I will tell you, these guys, the Rubella or the measles, that actually did do some pretty good damage to the human race, okay? Little dots, and we'll explain that here coming up, the really big fevers. The problem with this guy is 7 to 14 days, and the reason that I'm bringing this up now is that, yes, we do have a vaccine for this, but this is where our anti-vaxxers, and these are folks that don't believe that we should give our children these, probably never seen measles actually go through somebody. And you get a lot of conjunctivitis. They get pink eye, the fever, the swelling of the eyelids. They get very light sensitive. Again, a lot of malaise, cough, and congestion with this, but a really, really high fever. They start to develop the little spots all over, especially in the oral mucosa, which is called Koplik spots. Again, this is kind of an early in the measles process, okay? And again, usually very effective, and that's why they had the mandatory vaccination. Yes, that's right. We have mandatory vaccinations. Imagine that. We've had it for a very long time, okay? And post-exposure hand washing, again, is critical. And again, they can lead to actually into encephalitis. So again, you get swelling in the brain from that. The mumps, these guys are a virus. It's usually a respiratory droplet. Large, painful salivary glands. Occurs in the 5 to 15 age group. 12 to 25 day incubation period with that. So usually you get exposed, and then 2 weeks later you end up with the really sore. It's usually benign and self-limiting, but again, it's very painful. And then they do have a vaccine for this one as well. It's actually measles, mumps, rubella usually all come in the same shot. Speaking of rubella, these guys, sore throat and a low-grade fever, rash on the face and the trunk, extremities, kind of similar to the measles in that regard. Again, it usually lasts about 3 days, okay? But the problem is you can get it it won't be 2 to 3 weeks until it actually shows up. Again, the treatment is supportive. However, if you have a developing fetus, I want to stress this, absolutely 1000% mom does not, and especially if they're in the first trimester, it causes major problems, okay? So if you've got a partner that's pregnant, or if you are pregnant, it being a female, and you're going to a potential rubella case, absolutely you have zero to do with that patient, okay? And again, your MMR vaccination, you should have this, especially if you're working in the field. And again, by the way, the immunizations is not recommended for a pregnant female. That's usually why they will test you before they give you that shot. And again, EMS workers are required to receive it before being allowed to work. so again, this is a mandatory vaccination, and so yes, we really need to take that. Okay, and I'm not going to get into that debate about the COVID vaccination, but again, there's a reason why these things work. Okay, there really is a reason why they work, and again, you don't want to get these horrible diseases. Okay, you really don't. RSV, again, we talked about this with the kids, and we're going into pediatrics. It's usually a lower respiratory infection that breaks out, guys. But in children, this can be a fatal disease. Again, you're going to have to the disease becomes more severe if they get pneumonia and a bronchitis with this as well. Okay. Again, wheezing, tachycardia, tachypnea, respiratory distress, and again, rapidly diagnosed by rapid nasal washing. Again, they'll do the swab to be able to tell if they've got this. And the high risk children, they actually start them on a antiviral agent almost immediately. And it does. And by the way, the treatment, for these guys are rather expensive, and it takes a little bit of time. Pertussis, which is the whooping cough, again, it's caused by bacteria in the oropharynx. Develops a mild cough, quickly becomes severe and violent, and it has a high-pitched inspiration, thus the excuse me. Again, and they have trouble because there's a large amounts of thick mucus that are actually blocking up the upper airways. And then again, the good news is most of our vaccinations in children, the DPT shot actually there is a vaccine available for that. Okay, the disease is likely to confer immunity. Again, you can still get pertussis even though you've had the shot. But again, one of the biggest things about pertussis is it's highly contagious. And again, if the patient's going into respiratory failure, again, get ready to intubate them. All right. Again, and just remember, you're going to have swollen airways, so be ready for that. Maybe making sure that you've got a tube size a little bit smaller there, ready to go. So to do this, mononucleosis. The Epstein-Barr virus is the one that causes it. It's about a 4 to 6 week incubation period, and that you develop fatigue, fever, sore throat. The problem is that these your spleen will get bigger because again you start to build up antibodies and you're working that spleen a little bit more. But it lasts for several weeks. By the way, kind of common. They call it. As a matter of fact, they kind of called it 15. They called it the kissing disease because that's the younger adolescents that would get it via transmission from kissing somebody else. And the full recuperation, by the way, is several months of supportive care. And usually you're going to be out, if you get this particular disease, remember, you're going to be out for at least 6 weeks until you're considered no longer contagious. Okay? So again, and it takes several months, it actually takes several years to get over that. Okay, herpes simplex. Again, this is usually transmitted on the saliva, the face, lips, skin. Everybody is susceptible to it. Used to be, it's a sexually transmitted disease. Not true. Almost anybody can get this. And again, they're the little whelps that appear on the face and on the lips area. Is usually how we know that they get the cold sore, if you will. 2 to 12 day incubation period usually disappears, and it can reoccur following, especially with periods of stress or illness. It can reoccur. So again, usually they treat it with an antiviral agent. And again, make sure you got your gloves on. And again, immunizations are not available for herpes. So kind of once you got it, you got it. Congratulations. Okay. Epiglottitis, swelling of the epiglottis. Again, they're leaning forward, they're drooling, they have respiratory distress. Okay. In children especially, it's a major emergency. We want to make these guys happy. We want to gently oxygenate them. We don't force the oxygen. We don't do anything that's going to upset them. I'm going to stress that statement again. And the reason that I really bring this up is because I know that there's a national registry scenario that involves a kid with epiglottitis. This is what you do. you put them in the truck, and you haul butt to the hospital after you recognize that it's epiglottitis. Okay, you don't go shoving things in their mouth. If you start shoving, if you start doing things and it upsets this kid, back off. Okay. And the reason that you back off is because you're probably making the situation a whole lot worse. The more you agitate them, the worse that they're going to get, because it inflames their little epiglottis, and then it cuts off their airway. Okay, let them lean forward, let them drool. Again, you can have the mom or dad wipe off the drool, lean them forward, blow by oxygen, and let's boogie to the hospital. Okay, now laryngotracheal bronchitis, otherwise known as croup, we talked about this with our kids. Okay, so this is a viral infection. It narrows the airway, especially the upper airway. The top part of the trachea is what actually it narrows. Okay, the steeple sign that we would see on the X-ray. Again, total airway obstruction is very rare, but it could happen. Again, they have a sealed type bark, expiratory stridor. It's usually inspiratory and expiratory, and it's usually due to a virus. And again, the best way to handle this is, again, they start using anti-inflammatories to bring the airway swelling down. If you do a transfer with these guys, make sure that you've got an X-ray and you know exactly how much airway that you have to deal with. If there's going to be a complication where you think that airway is going to close off, you truly need to consider whether or not you're going to transport until that airway becomes totally secure. I can't stress that one enough, gang. You really need to know how much airway you have, and if you feel uncomfortable with it, the answer is no, because again, they can treat it at the emergency room. They can secure the airway as needed there. They can call in a specialty transport team. Long and the short is you don't want, the last place you want to be intubating this kid is, or this patient is up there. Croup, by the way, is usually a low-grade fever, okay? Usually a low-grade fever, and the symptoms have calmed on over a couple of days. Back with epiglottitis, these usually come on pretty fast, within 3 to 4 hours, and all the symptoms are usually accompanied by a high-grade fever, okay? Pharyngitis, again, this is the pharynx and the tonsils, again, 5 to 11 years old. Usually a strep throat is the major cause of this, guys. And again, usually antibiotics, chloroseptic sprays work really good on these guys. And but strep throat, by the way, is very contagious, so make sure you got your mask on, because again, it is a droplet situation of the respiratory system. Sinusitis is when you get mucus and pus that can't drain, they're trapped in the sinus, and then you get nasal congestion, yuck. And then when it finally does start to drain, even more uck. Again, antibiotics, decongestants. You can apply heat packs over the area to help relieve some of the pain and help facilitate some of the drainage, okay? Again, the decongestants are probably your best thing here. Hantavirus is a family of viruses, the rodents such as deer mouse, and it's inhaled aerosol sitting the dry urine. Yuck, but it usually contaminates the food, okay? And there's no really immunization available for these guys, and if you're thinking that you have some sort of hantavirus, again, if they've got the pulmonary symptoms with that, again, a mask is definitely involved with that. I can tell you that I have not ever seen a case of hantavirus, so don't go too deep on that one. Gastroenteritis, though, I definitely have seen. Again, usually they've eaten something that they probably shouldn't have eaten, so they got some sort of virus or parasite in it, usually transmitted via the oral fecal route more than likely, or contaminated food or water. And again, usually an IV supportive care, rehydrating the patient. The biggest thing is they puke. And antiemetics are not necessarily a bad thing here. Once you get the stomach emptied, give them something to stop the retching, and then make sure that they stay hydrated with that, okay? Again, if they have prolonged vomiting, again, your Zofran or your Phenergan is going to be your weapons of choice there. Your food poisonings, again, it's a non-specific gastroenteritis again. But again, it's usually botulism or E. coli that's the guy that causes debilitation, illness, or death. But most of the time, usually when you get food poisoning, it's diarrhea, vomiting. You get the fun coming out of both ends here. So again, Salmonella, again, shingles, Vitiver colabre, Campylobacter. These are all are the bacteria that are in the food, usually because you ate something that was raw or undercooked. And the best thing you can do, again, usually stool cultures are required to confirm that if it's a bacterial cause. But again, for us, IV, cardiac monitor, give them plenty of fluids. And again, there's no immunizations against these guys. Encephalitis is when you get actual inflammation of the brain. Usually, it's very similar to meningitis, and they often actually coexist with each other. And again, these guys you have uncontrolled, but it's a brain infection. Okay, so it's gonna. Actually, in fact, I've had a lot of these that actually look like a stroke. Okay, so yes, you can have an encephalitis that actually kind of looks like a stroke type symptoms. Okay, the rabies, again, this is usually transmitted in unimmunized domestic dogs or cats or in the wild animals. And if we are bitten by those, then again, that's where the problems start. Usually, if we do not treat them, the death is within 2 to 6 days. Excitation, agitation, confusion. For those of you that have not seen the movie Ode Yeller, yeah, he got bit, and guess what? A couple of days later, they had to put him down. Very, very sad moment. Okay, so again, make sure that you wash if you had any type of bite. Do not bandage or dress the wound, allow it to drain freely, and then ensure that the suspected animal is secured. And again, they're going to have to test them for, again, especially if you believe that they are rabid. Again, soap and water, debride the wound. Again, hydrogen peroxide works pretty decent. And then they're probably going to end up giving prophylactic shots. And don't forget about tetanus in these guys as well. Okay, don't forget about the antibiotics as well. They're probably going to end up getting on those. Tetanus, again, we've already talked about that. Again, it's more commonly called lockjaw, but it can cause stiffness. The tetanus bacteria can actually cause the toxoid can actually cause stiffness in all parts of the body and can keep them locked. I know of one individual who got tetanus and he ended up, his knees couldn't move after that point. It took nearly 2 years for his knees to unlock. Okay. Lyme disease, these guys are usually more for, to get skin lesions. Again, it's usually a tick-borne, and that's what we worry about with our tick bites, is that they actually will end up in the Lyme disease is you get a lot of it's a spring and summer months, but it's usually a pain flat bite, and it's got the bullseye rash to it. I had one of these a couple of years ago. A tick got on me at Rescue 8, and yeah, I developed this ring rash, and I was like, ooh, snap. And so again, it was a couple weeks of antibiotic therapy with that, because the biggest thing is that it can develop into a meningitis. It can actually start Bell's palsy, actually, and in the late stages, actually, it can occur, years after the exposure. Sexually transmitted diseases. Okay, since most of you guys are of this age group, folks, again, take safety precautions is my best way to say this, okay? Abstinence the best way. Second best way is make sure you're covered, okay? Let's talk about gonorrhea. Again, about 1 million cases are treated annually. Everybody is susceptible to those infections, by the way. Usually painful urination and purulent discharge from the urethra. In other words, white, yucky stuff, okay? And then women, they usually don't have any signs and very, very minimal discharge at all, okay? But the problem is with gonorrhea is actually it can make them sterile, and they can actually develop abscesses within the reproductive structures, okay? It can cause peritonitis as well, and there's no immunizations for gonorrhea. Syphilis, these guys are transmitted, the lesions on the skin, and again, the infants can actually contract it from before birth from the infected mother. So again, there will be lesions on them. They will appear, disappear, and again, best way to do this is avoid frequent contact with the lesions. Make sure that you get good hand washing, and the treatment, of course, is a penicillin regimen with that, and that's usually deep IM injection, by the way. Genital warts. Oh yeah, yuck. Again, this is usually caused by the HPV virus, and uh, those are associated, by the way, a lot with cervical cancer. It's contagious. They're very easily spread. In males, it looks like a cauliflower, and then across. Got a picture here of the ladies here with the and then these are the warts around the labia area. But again, very contagious with those. Okay. Again, your genital warts, again, they usually appear on the labial surfaces, and they do have vaccines for this to help prevent the cervical cancer. Okay. Um, Herpes simplex, again, is susceptible, and you get the lesions on again, can be on the penis, the anus, the rectum, the mouth. Again, these guys, and it appears a lot like your simplex, the simplex herpes that we were talking about earlier. Like I said, the thing is these lesions last for a lifetime. Chlamydia. This guy is there's an intracellular parasite that is a gram-negativity. It also has a gram-negative bacteria with it, and again, it affects the genital areas, the eyes, and the respiratory system. Yes, everybody is susceptible to chlamydia. Okay, again, it's a leading cause of preventable blindness, by the way. And so the symptoms are very similar to gonorrhea. It's just less severe, but the problem is you start having vision changes with that. Trichinosis is again a protozoan parasite, usually common cause of vaginitis, and again, and in women they get a greenish yellow discharge from that, and then the frequent present with gonorrhea also, and the men are the asymptomatic carriers of this lovely disease. Okay. Chancroid, these guys are highly contagious ulcers that are gram-negative bacterium, the high risk to the men, and again, it puts the painful ulcer usually on the penis, or usually around the head of the penis. We're going to flip over that real quick one, because again, nasty picture, but it's got if you want to see the picture, I'll show it to you guys in class. Again, this is also a lot of HIV. If they've got the chancroid, they probably have an HIV infection along with it. Okay. Usually these don't appear. Again, anybody can get it though. Impetigo, again, a very contagious infection of staphylococci, and you get a single vessel rupture forms like a honey-colored crust, and then lesions on the outside. And again, it's easy to transmit. Again, make sure you're wearing your gloves with these guys. Lice, right? And so this is head lice, body lice, pubic lice, but they're little bugs that crawl in your hair, and then they have like small oval-shaped nits with them, with the lice. And again, usually they go from egg to nymph to adult, and then it's actually the adults that kind of transfer to other places. And pubic lice, again, is through sexual contact. Body lice gets all over the body and the surface of the skin, and it attaches the skin only to feed. Okay. Again, make sure that you isolate your linens. You definitely need to sterilize your truck. Definitely need to sterilize it. Clean on all wipe down areas, and you make sure that you're using an insecticide when you do that. Scabies have their little mites that are barely visible without magnification, and again, you usually get it from hand holding to sexual relations. But again, the female will tunnel into the skin. It causes intense itching. Okay, so and again, it remains communicable until you destroy all the mites and the eggs. And again, how you do that essentially is it requires. And by the way, anybody that gets treated, it'll actually go through gowns and goggles. So just you got to be aware of that, and you're going to probably require prophylactic treatment if there are scabies present. Bed bugs, again, small flat parasitic insects. They're reddish brown in color, really small guys. They generally don't transmit disease, but they do bite. They do leave little whelps all over the place. Usually if you pick the bed up and you look under it and you start seeing everything crawling, probably want to run for it. Because, yeah, right? Non-Sakomal infections, again, these are hospital-based infections, and this is what they combat all the time in the hospitals, is spreading diseases from one patient to the other. So that's what they're referring to when they're talking about this particular term. Again, the best way to intervene with these folks in these infections is educate your patients. Tell them how to fix it, again, and reduce the related amounts of transmission. And again, focus on that. Make sure that they understand. Look, bed bugs, we got to get rid of them. If they've got scabies, we got to get rid of them. Okay, and lice, there's ways to get rid of the lice. Okay, so again, and take the lead in this, and make sure that they know means in which to get rid of them. Again, lice, they have over-the-counter treatment as scabies. Usually requires, they do have it. They do have stuff over the counter, but it's better to get the prescription stuff on those. Okay. We've kind of made a big deal during COVID about this one. If you're sick, don't go to work. If you got diarrhea, don't go to work. If it's wet and gooey and you're producing it, don't go to work. If you're jaundiced, probably a bad idea. If you have mono, time to work from home. Again, if you're exposed to lice or scabies and they have not been treated yet, don't go back to work. Okay. Again, make sure that if you don't go to work, if you had a strep throat, if you've had a cold, if you've got a fever, don't go to work. Okay. And approach everybody as if they've got the disease until you can kind of prove otherwise. All right. High index of suspicion. Okay. When you get done with the call, wash your hands. Take off your decontaminated equipment. Spray your gurney down, wipe it down correctly, wipe and mop the truck, get all the stuff, and if you get an exposure, make sure that you report that exposure. Okay? Again, these are all required by OSHA and NIOSH when you get a job that they go over this. So yeah, every time you go to a new employer, guess what? You're going to get this type of training, okay? So always consider the interaction with the three major factors: infectious agents, host, and environment, okay? Remember that, all right? We can stop it at all three stages of this. There's ways to destroy and prevent the transmission, okay? Again, be the role model on these things. Very simple. Sepsis. Again, septicemia is the most common cause, especially when we have life-threatening end organ failure, okay? And again, our sepsis criteria, again, you can have sepsis anywhere. A urinary tract infection can cause a patient to go septic, all right? Again, but it's when you start having the vital systems shut down. End-tidal is below 25, okay? Which is why you put end-tidal on everybody, all right? So especially if you've got sorts of infection, all right? And usually these guys, they're more susceptible when they're immunocompromised. Anybody on this list actually is a very susceptible for that, and we need to be thinking that, okay? Especially if you got a heart rate above 100. They says 90 a minute, but usually 100 to 110 when they're not the pediatric patient. Abnormal body temperature being hot or cold. Remember, if you've lost the ability to fight off the infection, you're actually going to end up going colder because you stop producing as much energy. And then severe sepsis is when the presence of evidence of hypoperfusion, okay? So how do we treat the hypoperfusion? Fluids, more fluids, give them more fluids. 2 to 3 liters of fluid is not uncommon. And then you might actually have to give a pressor with these, okay? Well, vasopressor, our weapon of choice here is norepinephrine. Epidrips do work, but norepinephrine is a much better choice here, okay? Now, again, sepsis, the problem is that we're putting people on the walls that have sepsis, and the problem with that is they stay hypoperfused. The longer that they stay hyperperfused, the worse off their outcome is, okay? I know this has been a really long chapter, guys, and there's a lot of things in it, so make sure that you read up on these things. Make sure there's a lot of material in this, okay? Lots and lots and lots of material. Make sure that you go over that. Make sure that you review all of this material. Again, make sure that, guys, we're a key factor in, let's make sure that they don't spread these diseases, okay? And there's ways that we can help do that. Guys, that's it for this one. We're going to see you on the next one. You guys take care.